So let me just hit record. So good morning, everyone, and welcome to the Manhattan Family and Professional Information Committee meeting for May. This actually will be our last meeting before our summer break, and then we will return again in September. I want to thank everyone for joining us. My name is Wendy DeLeon, and I am the co-chair of this committee, as well as the Housing Assistance Services Director at ADAPT Community Network.
And I am Louisa UC Roche. I am the other co-chair of the Family and Provider Information Committee, and I am a regional director at Care Design New York, one of the 3 CCOs.
Thank you, Lisa. And I know we have a presentation for you today, and the presenter does have a hard stop, so we want to be respectful of her time. Lisa, do we have time to do announcements now, or should we do them after the presentation?
I'm wondering if we can do them later. We might have some people join that would probably want to hear those, so maybe we can do those at the end if that's okay.
Sure. In the meantime, if anyone has any flyers or information to share, there's also, excuse me, the chat available. So, excuse me, you can start sharing via chat. Also for, well, I'll let Patricia let us know how she wants to handle questions.
I'm sure we can take questions in the end. Louisa, I'm going to share my screen, but if I have any trouble with that, I may need you to help me. But I'm going to give it a go here. I know that once I share my screen, I can't see anything except the presentation. So if anyone's putting anything in the chat, please, let me know.
Wendy and I make excellent moderators. Well, moderate.
Are you able to see my screen?
Yes, we are.
Okay. Wonderful. So thank you for having me. And I know I'm being given credit for presenting, but I'm also have a co-presenter. My name, I'll introduce myself and then I'll let her introduce herself as well. But my name is Trisha Chapman and I am the Director for Care Management Specialized Supports at Care Design New York. And I'm presenting today with Amanda. So Amanda, if you'd like to introduce yourself.
Good morning, everyone. My name is Amanda Clyburn. I am one of the behavioral support specialists with the healthcare management team at Care Design. So I'm also here to assist Patricia with presenting. Thank you, Patricia.
Thank you for this opportunity. I think, it's always great when we can share some information and, learn from each other. So I think this will be a good opportunity for all of us. So what we're going to be talking about today is crisis situations, what your care manager can do to support in those situations, and how your care manager can collaborate with some of the community resources and other agencies that we partner with to help manage those situations. All right, I changed my slide. Can you see the new one? Just so we're good?
Yes.
Someone give me a little thumbs up.
Yes.
Yes, we're good.
All right, thank you. So when we start to talk about, crisis situations, before that, we need to take a little bit of a step back and talk about what are the social determinants of health, because these are the things that can impact a person and ultimately lead to a crisis type situation. So as a care manager, care managers are taught to really look at the person as a whole and all of the other areas of their life that could potentially impact their health. So I'm going to go through these briefly because sometimes that's a little bit, odd to think about when you think about a person's health and how could housing affect that. So for housing, it's not just, where the person lives. Do they live in a certified setting? Do they live with their family? Do they live alone? Within that home, do they have access to the resources that they need? Do they have access to the care that they may need, maybe with self-care tasks? Do they have access to other supports outside the home that they may need? When we talk about food, it's not just, do they have food in the home? Well, that's extremely important, but do they have access to healthy food? Do they have the ability to prepare that food? Do they have money to purchase that food? When we talk about education, are they in the correct educational setting? Are they able to get the services that they need within that setting, OT, PT, speech, If they want to pursue something outside, when they're adults, do they want to take classes? Do they want to go to college? Do they have the means to do that? Are they getting transportation to that setting? When we talk about employment, does the person have meaningful employment if they want that? Do they have income coming into their home? If they want to have a job, are they able to get the support they need to maintain that job? Is there some other thing they may be interested in doing during the day? Maybe volunteering or, participating in a day hab. So we talk about employment, that's a larger picture. Then there's the benefits. Does a person have health insurance, dental insurance? Are they able to also access, if they need SNAP benefits, which is used to be called food stamps? Does the person have access to Social Security income if they need that? Transportation is one of the biggest things that affect people that we typically support through care coordination, because many of them do not drive and transportation is very limited. So do they have access to get to the places such as medical appointments, a place of worship, to social activities, to work, to school? That's a very big thing that can impact a person. And then we talk about social supports. Do they have relationships in their lives? Do they have natural supports, friendships outside of the home? Are they able to engage in meaningful and fun activities that they would enjoy? So we really want to look at that whole big picture, because any one of these things, or the lack of any one of these things, can certainly impact a person's physical and mental health. So care managers focus on providing person-centered services. And by that, we mean putting the person at the very center, and then all of the other entities in their life on the outside, so that they can support that person in the best way possible, so that that person can live a happy and meaningful life. So you see in the slide, it's the community providers, OPWDD, their healthcare, the care coordination organization, the family, the school district. And when we say community providers, there are so many different providers that would entail. So that's, how we start to take a look at the person, how we support the person. The care manager always tries to engage in these other entities to make sure we're doing the best that we can to have the person in a happy and safe environment.
So in regards to this section, this is more about crisis situations, what crisis situations can entail. And when we speak about crisis, there's numerous different types of crisis. You could have, a behavioral episode that could be present. There could be a caregiver that is no longer able to provide support. There could be a forensic matter, something legal concern, homelessness, hospital discharge, a medical concern, whether it's getting better or it's getting, worse, or it's something new that's present. There can be a missing person. There could be a need of housing, residential need, or something going on within their residence. It could be a school-related issue or some type of substance usage. So those are some examples of some of the crisis situations that could, trigger a crisis. And when we go to the next slide, I wanted to just speak about CSIDD. CSIDD is, it's a crisis service for individuals with an intellectual or developmental disability. They offer crisis services such as preventative and response assistance if an individual is presenting with any behavioral concerns or their family needs support. The goal of CSIDD is really just to help that individual develop more positive relationships within the community and assist with growth and success within their life. CSIDD is a 24-hour service, and it's eligible for all OPWDD individuals ages 6 and up. So some of the services that CSIDD provides is they provide community training and education, whether that's training within a residence or just in general education. They also provide mobile crisis support and response. And when I say mobile crisis support, that's in relation to crisis prevention and intervention planning. So they can come in the home and, assist. So if there is an individual that is in crisis, they are there to, assist and, assess that individual to see how they should move forward, whether that individual should be hospitalized or identify more coping techniques or, find potential triggers. They also offer in-home supports. Some of those in-home supports can include parent support, when they do come in a home for crisis. And they also have a resource number. It is a short-term service. It's not long, it's a start. And they also have respite. So in the event where if an individual is in crisis, they can go and assist, and they have their own team. Similar to like a hospital dynamic where they have a prescriber, they have a doctor there, they have a nurse there, they have a therapist. They also offer parent-to-parent support. So say if, a parent is struggling with, an individual's behaviors, they can come in and assist. They'll assess, and then they'll also find out different ways, different triggers, how they can help that parent. And lastly, they offer employment support. So if an individual wants to seek employment, they can help with that interviewing techniques, and just kind of getting them prepared and ready for employment. So overall, when it comes to applying for CSIDD services, a referral would have to be submitted by the individual that wants the service. A case manager can assist with that, as well as a family, a provider, whether that's a psychiatrist, a therapist, the hospital, as well as crisis services. So yeah, CSIDD is a really great service to utilize. And in regards to this section, I'm just going to read the example of the scenario. We just kind of wanted to go over different potential scenarios and how a CCO services can be utilized and assist. So I'm going to read that first one. So Dale is a 21-year-old man who lives with his mother and grandmother. Over the past few months, he has been increasingly aggressive and has caused both his mother and his grandmother to need medical attention. He punched holes in the walls and broke furniture. His mother is now in danger of losing her apartment. So when it comes to this situation, due to Dale's increase in aggression, including punching the walls, breaking furniture, it's resulting in the family member needing medical attention and the potential possibility of losing the apartment. Looking at this crisis collaboration chart, how would we assist Dale? So when it comes to this, some potential steps that could be taken to assist him would be you could apply for CSIDD services. Once again, they offer mobile crisis, respite, parent-to-parent support, and they have a resource center there where they can also offer short-term therapy. We could also, if not applying to CSIDD, utilizing local mobile crisis. There are mobile crises in the area. And with the mobile crisis, they come in the home and they support and they assist with crisis intervention. So they figure out what potential triggers there were and how can they de-escalate the individual that is currently in crisis. Also, contacting 911, and when contacting 911, you could complete a wellness check, just to make sure that member is okay or that individual is okay when it comes to being in a crisis. So generally, when it comes to looking at this chart or just in general, you want to also keep in mind, does that individual have any mental health providers, such as a therapist or a psychiatrist? What are the potential triggers that cause this behavior to be present? And depending, looking at the part when it has the school district, we are not sure if this member is in school. So say hypothetically, if the member is in school, what school supports are given? Does this member, if the member was younger, does this member have like an IEP, an individual, or an aide, or any additional therapy that in school can provide? So those are kind of like some of the potential steps to take if an individual is in crisis. Thank you, Patricia.
Thanks, Amanda. So we're going to go back to if I can get my computer to cooperate, we're going to go back to the previous slide. Just one second. Got it. And for the, I just showed that chart, and we're going to refer to that chart quite a bit. And after, I do believe you'll be getting a copy of the presentation, or Louisa, you're able to do that, correct? Okay. And that's just a really good reference point of some of the things that the care manager can do and how we can collaborate with the other organizations, as Amanda had mentioned. So we thought it would be easier to really go into these scenarios so you have an understanding of what a care manager might be told from a family, and how the care manager would start to dig in to support in that situation, just as Amanda had described with Dale. So our second scenario is Michael. He is a 20-year-old man who has many friends in the community. He is social, and having friends is very important to him. He has fallen in with a crowd that has been taking advantage of him and asking him to steal things for them. He was arrested on a felony charge, and he is out on bail. Now, of course, this is a very small percentage of the population that we support that wind up in these situations, but every once in a while we do hear about someone who gets involved with the criminal justice system. And maybe it's something as serious as, a felony. Other times it could be something, a little bit lesser. But regardless, when a person and a family is faced with this situation, there's a lot of, fear. How do we do this? Is my loved one, going to be incarcerated? How will they handle that? How are their needs going to be met while they are in jail, if that should happen? So there are some things that your care manager can do to help support in these situations. First thing, and the most important thing, is to obtain consent, the care manager to obtain consent to speak with the attorney in these situations. And we really encourage them to do that and to ask the family or the member to give that consent. And that is so that we can provide any information about their disability, any evaluations that might be needed for their defense. We also, we always notify the OPWDD forensic liaison, and that's just a person at the state level who follows these cases. And sometimes they're able to make some inroads that a care manager cannot. They also have some other access to records that we may not be able to see, as far as the, timing of court and so forth. It's preferable if they can attend a court proceeding with the person so that they can support. They cannot testify or speak on the person's behalf during that session, but they can be there to support. And perhaps after the court session, have a conversation with the person to make sure they fully understood what was happening during those proceedings. They can also, assist to make sure that the person is connected to a public defender or legal aid, or if they have their own attorney, just making sure they get legal representation. There are times when a person goes to court and they say to them, you're entitled to a public defender, and you have to go and seek that person out, and they're not really sure where to start with that. So a care manager can assist with something like that. If the person is incarcerated, a care manager can also call the jail social worker. And the reason that might be important is we want to make sure that the person is doing okay, but we also want to make sure that if the person is taking medications, that the jail is aware that that is necessary. Now, the jails usually require that the person also give consent for that. So when we make that phone call, sometimes it's, hey, we support this person. Can you get consent to speak with us? And once we have it, we can share some of those really important things. When a person is arrested and they have a disability, we can also talk about having their competency evaluated to see if they understood the charges. Now, that's people sometimes get confused about what that means. So what we have is what they call a 730 evaluation. And that evaluation, only an attorney can request to the judge, and only the judge can grant that that evaluation to take place. But that evaluation only determines the person's ability to understand the court system. It does not have anything to do with, what their IQ is and their understanding of, other matters, maybe self-care and things like that. This strictly is based on, does the person understand the criminal justice system? If a person is found not competent and it's a misdemeanor charge, typically, but not in every case, but typically the charges are dropped. If the person is charged with a felony and they're found not competent, they may be remanded to OPWDD custody, depending on the seriousness of the situation, in which case OPWDD has 2 facilities where a person would be sent to, where they would have the ability to learn more about the criminal justice system, and then they would serve 2/3 of the time for the crime that they would have served in jail. A little bit confusing, but it really is based on their ability to understand the court proceedings. That's what that is determined on. OPWDD can also assist if the person is, when the person is being released, if they are incarcerated, with developing a safe plan for reentry. They can also, if the person has the charges dropped, they can work on developing a risk management plan so that we can support the person in the best way possible. And that goes really hand in hand with the care manager, making sure that we're trying to prevent someone from reoffending. The family member, how their involvement, obviously, to continue to support the person, to work with the care team on doing anything we can to make sure that the person is safe and that they have all their needs met. Some community offices that are involved in this is, the public defender's office. Sometimes in situations, we can involve a local mediator, a legal mediator, and not necessarily, and then just take that back to the court, having resolved the issue already. There's also crime victim supports in every community. And the reason we need that for a person, even if they are the offender in this situation, sometimes they are being manipulated, as in the scenario that we discussed earlier, and they may need some support. They also will likely need counseling. This is a difficult situation that they found themselves in, and they would probably look for some additional support. And they can also help with understanding the reasons why things happened and getting them to accept the supports and services that they need. If a person is in school and they have a forensic issue, there are different ways the school handles that. There are sometimes, depending on the circumstances around the crime, they may need to attend a different school, and the school district would work on with the family and the care team to find an alternative school setting. All right. So the last scenario that we're going to talk about today is little change of pace here. Anne is a 56-year-old woman who has lived in her family home for her entire life. She requires assistance with personal care, money management, making medical appointments, and taking her medication. Until recently, her father provided for all of her needs. Her father is aging and has developed health issues. He is hospitalized and will be moving to a nursing home soon. Anne has a sister who lives out of town and has agreed to stay with her until housing is found, but she cannot support Anne long term. This, unfortunately, is a situation that we hear about quite often. And in these cases, a care manager has to first look at the person. And, we talked about that, looking at the person as a whole. What are their natural supports? So we see here that she has a sister, but that's only a temporary support. She's losing her greatest support, which is her father. She's also losing the place that she has lived in for many years and her caregiver. So care manager would first be looking at what type of setting is most appropriate for Anne, looking at the needs that she has. Is this a certified setting, such as an IRA or a group home? Can she live in an apartment with supports? Can she live independently? Those are the first things that the care manager starts to look at when they're determining how to help in this particular situation. So in our chart here, it kind of falls into different areas, because it can be, we start to first look at the caregiver no longer able to support, but we also have to look at the fact that she needs residential care immediately. So first, while her sister is there, we would probably want to look at, how can we collaborate with some community supports? Can we get in a home health aide? Can we get her some respite? What can we do to support her while we're waiting for residential services to be able to be found? And we'll talk about that in a minute, but that sometimes can be quite a long wait list. We want to, connect with OPWDD, tell them that this is an emergency situation, let them know that this is a crisis and this person will be in a position where she cannot support herself in a very short amount of time. We also want to look to the family. Is there anyone else in the family that can assist here? Is there anyone else who can, participate in taking care of her until placement is found? We may also need to involve Adult Protective, Office of the Aging, ACS, depending on, in this case, Anne is older, but if it was to be a child, and then, home health aid providers. And obviously, this is going to be a very traumatic experience for Anne. She might need to also look into some counseling. Just going to jump to the next one here. So when we talk about, her in this particular case needing residential support, what would the care manager do? So I mentioned we first look at, what type of support she needs. In this case, it would probably be residential, but for others, it might be community housing, or maybe we're looking at, connecting with the Department of Homeless Services. Are we looking at, putting in supports in the home or a supported apartment? Are we looking at Section 8 housing or a housing subsidy through OPWDD? The care manager would have to really assess all of those things and determine what's the best course of action. Through OPWDD, we have IRAs, which are our group homes. We have supported and supervised apartments. There's something new that they're just developing, which is called a CAF home. And that is meant to be a transitional home for typically younger folks who are coming out of a residential school with some behavioral challenges. And this is meant to be a short-term placement up to about 18 months where they can get, a more robust counseling and supports within the home to deal with behaviors and so forth. Or they have a housing subsidy. So it depends on the person's needs. And, and so for residential support, we know that once the care manager applies for that, that could take quite some time. OPWDD does not have a wait list, as people would suspect. What they have is residential openings, and the agencies that have those openings do their best to try to match a person in need with that opening. We want to put the person in a situation where they're most comfortable and their needs can be best met. So it's not an automatic or a quick turnover. While that does happen sometimes, it is not always the situation. So we did not plan to go through each one of these scenarios, but we know that, anything can be a crisis, and a crisis is different to everyone. So some of the things that, we did not talk about as crisis situations are a school-related need. Certainly your care manager would be able to support through, attending meetings, getting an educational advocate to support, connecting with the council for children and family, working with that school district to make sure those needs are met. Amanda mentioned earlier the potential for a missing person. Sometimes our folks, decide that they want to go out on their own. They may leave the home, and it can be a very scary situation when a caretaker does not know where their loved one is. And we can assist with that too. Generally, that becomes a police matter, but we can certainly assist in any way possible to support the person and the family. There's also, hospital discharge. When a person is leaving the hospital, it's care manager's responsibility to try and make sure there's a safe discharge plan and the supports are in the home, wherever that home may be, either, certified or with their family, that they have the things that they need so that their needs can be met and their follow-up appointments are scheduled and there's a means to get the person to that appointment. And lastly, substance abuse. We do have, people that we support who find themselves involved in, where they have a substance abuse issue and they need additional support. And we are able to try to connect with some of those supports in the community. We also try to connect a person with those situations with peer supports, and also to support the family who is trying to manage through this situation with their loved one. So overall, those are some basic or some of the situations we see most often, I guess I would have to say, in care management, and how you as a parent or a family member can support a person with the cooperation of your care manager to help resolve some of these crisis situations. All right. There we go.
So I just want to jump in. This is sort of a tough topic to cover because we find ourselves in crisis suddenly and often without a lot of warning. And so a means of capturing what to do is a tall order, right? And sometimes just having some resources and some idea of where to take your first step is the momentum that you need to get yourself forward. So I think the purpose of today's presentation, and thank you, Tricia and Amanda, for that, is to really hone in on some of the first steps. And every single person's situation is going to look a little different. Crisis can be very overwhelming, and though everything is into crisis, what feels like crisis to one person might not be a crisis to someone else. And so really looking at solution-focused ways forward, as a parent, as a provider, as a care manager, as a day service provider, even knowing what resources are out there, who can help, right? At any point of contact with a person supported in our service system, there is something that all of us can do in order to provide support and to provide resources. So obviously, speaking from the part of the CCO, it's a matter of collaboration. So collaborating and developing relationships with hospitals, with local police. If we've got some folks that we support that are frequently in need of emergency services intervention, and having a relationship with the local precinct, with the local EMS folks, right? Having them know who this person is in order to have the safest interactions possible has been really life-changing for a lot of the people that we support and their families. Having information about shelters. Unfortunately, we have folks that become homeless and are unable to sustain regularity in their medication compliance, in their financials, in attending to programming. So finding a residential provider to accept them into a viable placement can be a real challenge. So knowing how to navigate the shelter systems, being able to connect with Department of Homeless Services, looking at alternatives, right? Getting creative with how we pursue a way forward for supporting somebody in the best way that fits them, and not for them to fit exactly into a subscribed idea of what services look like for everyone. And then just other community-based organizations, right? We need to now more than ever look at things through a broad lens and look at any possible way of providing support, because many of us as providers know how very short-staffed and limited our opportunities are for programming, reductions in units, budget cuts across the state, not having enough open beds, not having enough transportation opportunities for our programs, having empty seats. What else can we do to bridge the gap? And a collaborative relationship across the board seems to be the most solution-focused way forward. So we wanted to make sure that we had some really easy to grab ideas at the end of this presentation, so that hopefully everyone here can walk away with something useful that you can apply to somebody that you help, somebody that you parent, somebody that you support, or somebody that you work with. There's a couple of links for some additional resources that might apply to some of the areas previously covered that you can use in the future. Obviously, our DD Council, not to plug us, but it is updated every year. We have a wonderful resource guide that has a wide variety of providers, and that gets updated every year. We've got the New York City government website for a list of all hospitals. So every single New York City hospital and all of the resources and specialty departments per hospital. So you can go to Bronx, Manhattan, Brooklyn, wherever it is, and you can look at the list of hospitals, and there's a drop down for all of the resources within those hospitals, right? Some hospitals have psych ERs for children, some don't. Some have other behavioral supports that others do not. So these are opportunities to take a look if you're ever in a situation where you need to refer somebody or you need to look up the nearest hospital. Advocates for Children are a really great resource for educational advocacy. So if you're not getting enough supports in the school, in the classroom, if you need to pursue possibly residential school placement, you don't know where to go, they have wonderful resources and are able to answer a lot of questions and support families in advocating with the Department of Education to get some of those therapeutic supports, staffing supports in place to hopefully prevent. The idea with a lot of this is reactive, but if we can get to a good place and make those referrals and connect with providers, we're hopefully preventing some of these things from taking place to begin with. and drug rehab centers. American Addiction Centers has some information regarding specifically supports for people with physical or they call it mental disabilities because it runs a gamut of Office of Mental Health, OPWDD, and a variety of other cross-systemic diagnoses. But they do have some integrated substance rehab resources, which are pretty tricky to come by sometimes, right? Finding services therapeutically for somebody who has a different level of understanding of the therapeutic process, really, I think is a wonderful resource. So we wanted to put those links on here as well to make sure that y'all had something to take away from the meeting that you might be able to put to use later on. And that's it for me, Trisha. My 2 slides. I think, Trisha, you're still muted, so I'm not sure if you can unmute.
There you go. Thank you for having us today, and I hope that you found this helpful and you have some takeaways with the additional resources that Louisa has included. And your care manager is a wonderful resource. Their job is extremely challenging because there's so many different things. Everyone is so unique and they have different needs, and the care manager really looks to make sure that they're finding the best way to support everyone. So thank you very much for inviting us today.
Thanks, Trisha. Mary, you had your hand up.
I did. I just wanted to add, as a parent, my son Nicholas is part of the program, and he has been for quite some time. We really never used it, but it always felt like a safety net for me, that Nicholas's behaviors and just his profile was in a system that if we were traveling everywhere in New York State, especially up at the country house, and Nicholas had behavior, that people could know him pretty easily, and especially traveling upstate. But I also wanted to say, like, one of my favorite things as a parent is behavior is a form of communication. And since Nicholas does not have words, the behavior is really a frustration for him because he knows what he's thinking and we're not getting it. So all the people there have been so kind to my family and so supportive. And I just wanted to shout out, for a job well done. Thank you.
Thanks, Mary.
Thank you, Mary. You actually brought up a good point, because usually when you hear about these kinds of services, you think that you have to be in crisis, like Lisa said, sort of reactive, in order to sort of take advantage or start doing your research. But I think from what Mary said, we can take away that you can start some of the process now, right? You can very much sort of like overnight respite. You start the process early on, so when you need the service, it's there for you, right? It kind of cuts through some of the things that you need to do in the moment, being that you're already in crisis and likely don't want to have to deal, let's say, with the paperwork or the looking of evaluations and all that stuff that you may have to do. So also just please keep that in mind. And when you're sharing this information with the families that you support, and you're talking about this service, also please keep that in mind. You want to prepare for any of the eventualities that you can, and it's one of the reasons why one of our biggest parts of our job is education, right? We want to educate the families on the services that are already available, so if they get to a point where they feel they need them, they already know they exist, they already are somewhat familiar with what it entails and what they need to do in order to get that service. So please remember that when talking to your families about this service as well. It's amazing to have this in place, something that can be linked to people who already are familiar with IDD, with some of the behavioral concerns that people with IDD have, as opposed to, although calling 911 sometimes is called for, but as opposed to that always being your backup, right? So thank you. I just want to add my thank you for providing all the great information. And of course, this was being recorded, so that will be shared with everyone. I did just want to say, because this happens sometimes, if you heard about this meeting through word of mouth and for whatever reason you don't receive the general emails that go out through the Manhattan DD Council, just please email Luisa or I directly, and we can put our emails on the chat for you so that we can ensure that you get a copy of the presentation. I'm sure anybody else have any questions? I didn't see anything in the chat, but
I just had an observation.
yes.
Okay, thanks for the presentation. It was great. Very thorough. I would just add, possibly, if possible, under the OPW crisis collaboration, I saw the intensive behavior supports, that type of stuff, but also there are family support behavior management programs. And some of them are underutilized. And I think that they also are a good resource for certainly the behavioral situations that come up. So yeah, that was pretty much just what I wanted to add.
Thank you, Jay. A lot of these types of programs are underutilized. I think there's a bit of a stigma or something with families dealing with a loved one with certain behavioral concerns, and trying to sort of gatekeep that, not let people know that they're struggling at home or that they can't, work with their loved one. And so sometimes it's challenging to talk to people outside of the family or even within the family about what may be going on in the household. So when discussing these services with people, I think one of the things we have to keep in mind with families is our approach, right? How we introduce the services, and letting people know, this is there to assist. There's no shame in saying, my child can be violent, or I'm not sure how to deal with my child or my loved one when they get this way. And really putting some emphasis on that. I know culturally, being from an Hispanic family, it's always like, nope, things that happen in the home, stay in the home. Almost like Vegas, if you will. If anything that happens in Vegas stays in Vegas. So it's very important to not only say that to families, but consistently say it, right? Sometimes people need to hear it multiple times in order for it to sink in. So again, thanks, Jay, for sharing that, because it is one of the services that is underutilized, unfortunately, but very much helpful.
I just noticed Michelle from Advocates for Children, who we plugged and happens to be on the meeting, which is super lucky. And thank you for putting your information in the chat.
Thank you. I was glad to have the shout out. So thank you. But in all seriousness, we get a lot of these kind of cases. We also have a helpline Monday through Thursday. I'm trying to look it up real quick because I don't know it offhand, but
your website was super updated. So
yeah, we just updated. We have guides and resources for parents in different languages. And like I said, we have a helpline. It's an 888 number that anybody can use, parents, schools, professionals, if they just, want to get advice. In terms of taking on clients, we have an income scale, but if you meet our income requirements, you can get free representation if you need to do an administrative hearing with the DOE or just to get an education advocate.
Thank you so much, Ms. Eaton. Honestly, y'all, it's what Wendy had said. It is education, not just for the parents, but for ourselves. At Care Design, and I know that at the other CCOs, there are very similar processes, but we have interdisciplinary meetings to review crisis situations, escalate to get recommendations from nursing, healthcare, behavioral teams. And at least once every one of those meetings, somebody brings up some incredible resource I had never heard of. So you can be doing this for 5, 10, 15, 20 years, and still somebody has this wonderful nugget of a resource that, when is shared, can make a really remarkable difference for a lot of people. There was just one shared recently of a women's therapeutic center in Manhattan, and I'll try to get the resource to send out with this, but it provided a couple of folks that we knew were struggling with some really great resources, and I'd never heard of it before, and they're not connected to OPWDD, but they were still this really remarkable community local resource that was going to make a huge difference for somebody. So I think every little bit of that we don't gatekeep, like Wendy said, that we do share those resources, and the more the better. So thank you everyone so much for participating. Thank you, Ms. Eaton, for jumping in. Trisha, Amanda, for your presentation. Hopefully this helps someone. Hopefully if you're a care manager on here and you run into a crisis, that you can reference this and just sort of get yourself unstuck a little bit and take the first step, but always escalate to your leadership regardless of what CCO you're with. All of us work in very, very much the same ways. Escalate to your leadership, get support. You're not by yourselves. We have each other to support each other, and you can always reach out to Wendy or I, and we can link you back to the information here if you misplace it.
Thank you, Lisa. And actually, with that, I think if nobody has any questions or other comments about the presentation, we'd like to just open it to allow people to make any kind of announcements, since we're in a sharing resources mood. I saw a couple of them in the chat, but I hope that there's more information to share. So please just raise your hand and unmute yourself. If I see more than multiple hands, I'll start calling people out. Jay?
Yeah, hi. Yeah, just to, again, I put the information in the chat, but LifeSpire has behavior management, parent training. It can be done either remotely or in the home. And if you're interested in referring someone, you can call me. The number is in the chat, or email me. Okay, that's pretty much it. Thanks.
Thank you. Anybody else raising their hand, wanting to make announcement, share some information?
Probably plug our DV Council Fair coming up in a couple weeks, which Wendy had put all this information in the chat about the professional resource fair that's coming up on Tuesday, May 21st.
Yes, thank you. It'll be from 9 a.m. to 2 p.m. We have 2 great workshops for you guys, as well as being able to access representatives from different agency providers, getting direct information, and networking, of course. It'll be at the CUNY Graduate Center, where we had our event last year, 365 Fifth Avenue. And I put in the link in the chat for people to be able to register for the event. I also want to mention to those of you representatives from provider agencies in our meeting today, there are still some booths available. So if you have not reached out, by all means, I put my email in the chat as well. Please shoot me an email if you're interested in a booth. Oh, I do see a question in the chat. Someone's asking, how can I please get a social worker for my 5-year-old?
Diane, if you want to put your email in the chat, I can send you an email and see if get some more information about your situation, and then give you some resources and connect you with somebody that can help.
Yeah, Diane, by the way, since if you are going to put your email in the chat, just be sure to send it directly to Louisa and not everyone, just because, it's your private information.
You can click the blue drop down where it says everyone and select my name, and then send that to me, and I will be the only one that gets it.
Thank you. And I also just want to make a quick announcement. Being that I'm also from Adapt Community Network, just want to let everyone know We still do have family reimbursement funds available, not only for Manhattan, but actually all 5 boroughs. We offer housing advocacy, home modifications, community rehabilitation, clinical services, day habilitation, overnight respite, and so much more. So please contact our information line known as Project Connect at 877-827-2666, or email us at projectconnect@adaptcommunitynetwork.org. All that is in the chat for you as well. Thank you. Anyone else with any other information they want to share or questions they may have?
I'm sorry, I did say y'all were gonna send out the PowerPoint. I just wanted to get the contact information of the presenters.
Yeah, I put my email in the chat.
Oh, okay, sorry.
If you want to just shoot me an email separately, I will happily connect you with Ms. Chapman and Amanda. But yes, we'll be sending out the slides.
Thank you.
All right, well, if nobody has anything else to add, I do want to thank everyone for joining us today. This will be our last meeting before the summer break. We will return in September. So please continue to visit the Manhattan DD Council website for updates on meeting times, meeting dates, and any other events hosted by the Manhattan DD Council, or even agency providers that are part of our council. So again, thank you so much. I hope everyone has a great summer. I hope to see everyone in a week and a half, a week and a half at our Manhattan DD Council Family and Professional Resource Fair. You know, we'll have raffles, we'll have nice continental breakfast, as well as information and the opportunity to connect with agency providers and network. So again, we hope to see you guys there.
Take care, everyone. It was good to see you.